an ideal world, once you've decided to have hip surgery, you just book in and get on with it. Sometimes life gets in the way though. Quite a lot of people who have hip arthritis are in their 70s and 80s, and it's often the case that they have a few underlying medical conditions such as diabetes, heart disease and higher blood pressure. Most of the time these aren't a problem and we can just get on with the surgery as planned. But what if you've had an event such as a stroke or a heart attack? Well, usually we recommend that surgery is delayed for about 6 months. This gives your body time to adjust and rehabilitate. You'll have been given lots of drugs to reduce the risk of a recurrence of the event, and they need time to do their job. After about 6 months, as long as you're well, then it's usually safe to proceed. We might ask you to see a cardiologist or a stroke specialist just to confirm this. What other things might delay surgery? Well, if you've recently had an infection such as pneumonia, flu or a urinary tract infection, then we'll usually want to make sure that you're fully recovered before we operate. We recommend that you take about 6 weeks for this. If you've been on holiday, particularly if it's been on a long haul flight, then it's best not to have surgery for a couple of weeks after you return home. This is to avoid the risk of a deep vein thrombosis or a pulmonary embolism. People often underestimate the impact of surgery and think because it's so routine these days that it must be a breeze to get over it. It is usually, but not always. I know that any delay in having your surgery is annoying and stressful, but our only concern is your welfare. If waiting a bit longer means that you're fully recovered from an illness, then you'll recover more quickly and reduce the risk of complications. And believe me, that's a very good thing. Thanks for watching.